All right, guys, let's quiet down. We have our first lecture here. We have the privilege of having Dr. Trauma Surgeon come and give us a presentation to us this morning. So think of questions you might want to ask. And these guys are on the side of emergency medicine, so be appreciative that they're here talking to you, okay? Go ahead, sir. Yeah, thanks, Ryan. Thanks for having me here. Pleasure to be here. I appreciate the work you guys do in the ER with our trauma and surgical patients. So what I'd like to do is just ask you guys, someone comes in, undifferentiated trauma by EMS, you're in the trauma bay. What are some things you're thinking this could be? What could be going on with this patient? Yeah, Dr. Innes.
Yes, cervical injury.
Sorry, I didn't get that. One more time.
Cervical.
One more time.
Cervical injury.
Sorry, I'm just not hearing that. Anybody else? Yeah.
Cervical injury.
Yeah, good. Cervical injury, C-spine. All right. C-spine. Good job. All right. Now, what would be a bigger classification that we put a C-spine injury in? What kind of classification of injury is that? Yeah, Dr. Innes again.
Yes. Oh, it would be categorized as musculoskeletal. Musculoskeletal.
Sorry, what was that?
Yes, I was just thinking if, somebody was out in a boot in their house, they may have fallen and have a musculoskeletal injury.
Okay, well, let's just say Mountie fall. Good. All right. I'm sure those are common where you're from. Oh, Canada. Okay. All right. Anybody else? What would we classify this kind of injury as? Go ahead. Yeah, you.
Musculoskeletal.
Yeah, good. Musculoskeletal. Good. All right. Well, thank you very much. That's all the time I have right now. Thanks for inviting me, Ryan. And keep up the good work, okay? All right, just a couple announcements before we keep going here. I want you all to know that at the hospital they are getting some new towels for us. We've been a little short. We know summer's coming on, and those new towels will be great that we can stuff them up in the air conditioning units to prevent any cold air from coming into those pods, because it is freezing in those pods. I'm sure you all agree. And then one other thing, third and fourth years, I hate getting emails, right? And I've been getting some emails from Heidi and from Stella, and we know you want to moonlight, but it is your job to turn in the right paperwork, okay? And I know that even if we give you the paperwork and tell you exactly what you need to do, and you do exactly what we say, and then we say you didn't do it, that it is your fault, right? So even if you did exactly what everybody asks, it's your fault, okay? I know Hannah Davis is working very thoroughly on this, but it is your fault. Please do not contact her to ask if she received your paperwork. Do not contact anybody. Moonlighting is a privilege, right? It's a privilege, right? That's what I've always said. You guys know you have it so easy. Your generation has it so easy. Back when I was a resident, it's so easy for you guys compared to what we had to deal with. When I was growing up in Detroit, I went to residency in Chicago. Back in Detroit, in Detroit, in Chicago, back in Chicago. All right, intern Joe, are you ready? Are you ready to go? Are you ready? Let's go. Want to get up there? Want to go? Want to get up there right now? Go on. Want to go? Hi, I'm John. I'm one of the new interns. Thank you for accepting me. This is my first presentation, and in corresponding to the Tintinelli's chapter on toxicology, I would like to present a topic on inhaled toxins.
Ooh, that's a good one.
So I don't know if you all saw the news about the fire last night. I did see the fire from the sky. I thought this might be a timely topic, so let's get started. Toxic inhalations is an interesting topic, and especially fires, there are some interesting toxins that need to be considered. Yeah. Okay, all right. Sorry to interrupt here. Ryan Hoffman, Program Director. Welcome, interns. Be glad you're at a community hospital rather than a poor education center like an academic trauma center. All right. So this is very important what he's talking about here, and he's missing some critical points that I just want to, emphasize. toxic inhalations in a fire, you gotta think about carbon monoxide, all right? Get that ABG, put them on 100% oxygen, all right? Think about cyanide, consider the cyano kit, and get them to hyperbarics, okay? I want you to burn this picture into your brain, okay? Burn this picture into your brain. Get the treatments going, and then, cognitively offload, okay? All right, go ahead, sorry to interrupt.
Man, he just stole all the information on my slides. What am I gonna do now? I know, a joke. He likes Ford.
Well, Dr. Hoffman, you probably know a lot about toxic inhalation, having worked in the Ford factory. Keep my truck's name out of your mouth. I must have dropped my pen. Tramp stamp. Biker on your left, clear the way. Biker on your left, clear the trail. On your left. Oh yeah, I apologize for the interruption. I just wanted to quickly say something. My name is Joe Betcher. I'm the ultrasound director, assistant program director. And I just wanted to give a quick reminder for some of you, and this will be new for you interns. Welcome, by the way, about how you should be preparing your presentations. So, is it better to have more or less? Is that better? Or that? Or even that? Well, research will show that actually less is more. Goofy. So if I were to prepare a presentation about myself, there I am, Joe Betcher. And this is an ultrasound. Ultrasound director. That's a mountain bike, and that is a wakeboard. This is a compensation vehicle. Those are my references. You see, you learned something. Less is more. Any questions? All right, I'll let you get back to that. Sorry for the interruption. Hey, I brought donuts.
In New York, we have bagels.
You know what they say about donuts. You do not want to miss them. All right, who wants a chocolate sprinkle? Looks like a curveball. I'm ready. Here it comes. I have some slides I could show if you want. Dr. McManus, did you have something? Nick McManus here, EMS director. I just wanted to add that there are quite a few new studies on this topic. I did unfortunately work last night, got off at 2 a.m., 4 hours after my shift. I did have to call the coroner on 7 of my patients, but I was able to review 72 journal articles on this topic last night, and one is interesting, 2018, New England Journal of Medicine, Smith et al., July edition, and they did an adequate study on this topic, N of 702, and it was an observational study, chi-squared analysis, and the sensitivity was adequate, specificity was slightly lacking, but it did otherwise compare with the other 17 studies, which I did review thoroughly and did write about them last night after my shift prior to driving here on my banana blog. I did get 20 minutes of sleep. Thanks, Nick. That was great. Now, I just wanted to mention one other thing to you guys. You probably all know that I served as a physician in the military. I was in the military. I was a physician in the military. We do a lot of things different in the military. I did serve in the military. I was a flight physician in the military. A lot of things are different in the military. So what's one other thing we can consider that is in our wheelhouse? Yes, we can consider getting a blood gas. Yep. High flow oxygen. Hyperbarics. Good. Cyano kit, very good, yeah. These are all proven therapies. What's something else we can consider that's in our wheelhouse? Thoracotomy, right? How might this work? So we inhale these toxins, it goes into our lungs, into our blood, through our heart, and then, yes, out the aorta. Cross-clamp the aorta, all right? You cut. You just cut. When in doubt, you cut. Just cut, I've been doing thoracotomies for over 20 years. When I think about that, actually, maybe longer than that.
Adam, are you finished with your... Oh, what are you doing? You stop playing with your food, Adam.
Oh, gee golly, Ma. I wanted to cross-clamp the aorta.
You do this every night. I told you stop playing with your food. No thoracotomies.
Can I at least strip the pericardium?
No.
Oh, but I won't get to use my new giggly saw.
No thoracotomies on your food.
Okay. Now, next week, I would like us to take some time again to talk together and share some cases about things that may not have gone so well. If the patient may have died. You know, for me personally, 64 cases related to thoracotomy. That may be shocking to you. Thanks, Adam. That was great. One other thing we need to think about, you guys know I'm big on scores, right? I'm big on scores. So what's one score we can use in this patient and should be using in most of our patients? The NFAS score. Have you heard of the NFAS score, right? We've talked about this before. The NFAS score. Look it up right now on MD Calc. Okay. NFAS score, 1 or more points indicates need for emergent endoscopy. Question 1, do they have an anus? Right. So does he meet criteria? Yeah, I guess so. Right. He's a 1. He has an anus. Okay. So go ahead and look. Right. Just look in there. You know, it's great. You can see internal versus external hemorrhoids. It's really amazing world in there. Okay. So use the scoring systems. All right. Use the NFAS score. All right. You can go ahead. Yes, Dr. Van Rees.
You got to kind of look at the numbers. People don't often think about this unless you've worked on the administrative side like I do. And you got to run the numbers. Look at the waiting room. Look at the time to be seen, the input, the output, the throughput, the sideways put, the intake, the outtake. And then that'll give you a lot more information on this topic.
Dr. Davis, did you have a question?
I just wanted to say, I like it when the boys smell like gasoline. It reminds me of the boys back home growing up.
Okay, Dr. Eidenberg? Compared to a lot of these other faculty members, that have large trucks with large toxic output, and I drive a Prius, very low output. But that doesn't mean the driver can't have some toxic output. Dr. Betcher? I just wanted to make one comment. There are other toxins besides inhaled toxin. You all may remember that I have recently planted some peach trees, and inside the peach, the seed does contain cyanide. And, so I would, stay clear of eating peach seeds. And, me, myself, I like to, my kind of go-to is just a good old peanut butter sandwich. Never gets old. Peanut butter sandwich. People may think you're goofy, but it's good for every meal. I'm Joe Betcher, and I approve this message. Yeah, Dr. Deaton, did you have something to say? Yeah. If you are on a dive team, you don't have to worry as much about inhaled toxins underwater because you do use oxygen tanks. I'm on the dive team. Dr. Davis, did you have a question?
Well, I just wanted to point out one thing for those of you in the global health track. There's not often these resources that we have here. So there are some things you can do for toxic inhalations in the third world. And one of them is simple as using a bottle. If you have a bottle, you take it and you can cut it, and then you take the other part of the bottle and you can jam it over their face and suck out the toxins. This is something you can do if you're in the third world. So, well, that gives me a new idea for a wellness event.
Dr. Innes?
Yes. I was deciding what we could do together is either do an escape room, or what I think would be better. Interns, you may have not done this before, but the rest of us, you'll be familiar with it. I think what we need to do is put our around the literature, okay? Our around the literature. So I've put some literature out there for you. You can split up into groups and open your Google documents, okay? So grab your literature. Good, grab it. All right. Now put your around it. No, for real. For real, put your arms around the literature. Okay, close your eyes, feel the literature. Okay, feel the corners, the arms of the literature, the cervical of the literature. Okay, all right. Now please fill out your Google documents and let me know how you experienced your arms around the literature, okay? All right, go ahead.
All right. Well, that is all the time we have here today. Thanks for everybody from our guest lecturer and intern Joe and all of you. And then lastly, congrats to our graduating fourth year class. This year, 2024, this class really, I got to say, this is the best class we have ever had. You guys are brilliant and beautiful and the most intelligent and hardworking class I have ever seen. I'm sure you're going to be leaps and bounds above me in the next month or so. And so congrats to all of you.